Hello, I'm Dr. Jarrod Bagley with Corrective Chiropractic, and one of the more common things that we treat in our office is knee pain. So I'm here to help you understand your knee pain and also give you some strategies or some things to do to help with to address that. So almost always knee pain is associated with mechanical issues, mechanical problems. Now, a couple things that you always want to rule out is, first of all, healthy nerve supply from the lumbar spine to the knee that goes to the musculature and the stability structures of the knee. If you have nerve irritation in the lumbar spine or in the low back, this can affect the biomechanics of the knee. And no matter what kind of rehab you do on the knee itself, it will be impeded by that nerve irritation and those imbalances in the musculature. The other thing that you want to rule out is acute injury or torn meniscus, torn ACL, torn MCL, LCL, any one of the ligaments of the knee. If there's a tear in those ligaments and it's severe enough, you always want to check to get that ruled out before you start any rehab program. Now, most commonly we see when it's associated with injury that it's more of a chronic nature. It's the habitual lifestyles that we've chosen and the habits that we create in our own lifestyle. But to best understand why this happens is it's best to look at the anatomy. So if you look at this diagram, the anatomy of the knee consists of the femur, this top bone here, the one closest to your hip. And then the bottom bones are the tibia, which is the inside bone, the bone in the medial side, or the middle of your, towards the middle of your leg. And then the fibula is the lateral bone, or the outside bone of the lower knee or the lower leg. Now you also see that there's the lateral collateral ligament, which attaches the tibia to the femur to the fibula, and then the medial collateral ligament attaches the femur to the tibia. And then you've got these two little ligaments that attach in the meniscus of the tibia to the femur. This is the ACL, the one that you can see in the front, and then there's the PCL in the back. Now, the meniscus is more like a disc in the spine. It's avascular. It's kind of like a Teflon coating that protects the ends of the bones from grinding on one another. Now, like I said, it is avascular, which in many cases people think that it doesn't repair or regenerate. Just because it's avascular doesn't mean that it doesn't give blood and nutrients to those tissues so that it can regenerate. And how it does that is you have a synovial membrane that surrounds the meniscus, that is all around it. And this synovial membrane acts as a filtration system. Now, the cool thing about your knee is that you have these muscle pumps. The soleus of the calf pushes blood into the knee when you contract it. So one of the best rehab procedures in order to get the knee healthy and regenerative and decrease knee pain is to pull the toes all the way up as high as you can. This contracts the calf musculature, the anterior calf musculature, and it pulls that blood in through those synovial membranes, and it creates synovial fluid, which is the lubrication of the knee. Now, the other way to help rehab this is just movement. Movement helps to push blood in through those synovial membranes, highly filtrating that blood and turning it into synovial fluid, which ultimately creates that lubrication within the joint as well. Now, in many cases, we're told that we need to be taking some sort of NSAID or non-steroidal anti-inflammatory, like a Tylenol or an Advil or something that is going to help with the inflammation and the pain. Or in some cases, we've been referred to someone that would inject a corticosteroid into our knee or into the joint. Now, I'm a little leery of that because ultimately, anytime that you take NSAIDs, they're known to decrease the integrity of the synovial membrane, and therefore decrease the amount of synovial fluid that your body can produce. So although it may decrease the symptoms immediately, in the long term, this is actually creating more damage to the knee because you're not as capable lubricating it on your own through just traditional movement. Now, my suggestion is to get in there and move that thing around and get the blood flowing in there, and it helps it lubricate, and helps to hydrate the knee, and also regenerate it as well. Now, if you'd like more information or help in problems that you're experiencing with your knee, please reach out to us. I'd love to be able to help you. Again, we're at Corrective Chiropractic here in Bee Cave, Texas, and I'd love to help you find out what's going on with your knee and help you formulate a plan to get you back to health. Again, I'm Dr. Jarrod Bagley, and thank you again for helping me be the doctor that makes people stronger.